Hi, welcome to your checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine doctor in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you were able to join us here again today. So you're jumping in here straight off of, this was a big 180. I was moody. I was very moody. I don't know why.
Yeah, you were, because you were hungry yesterday and today.
I know. Well, I got up and got right to doing stuff after our talk, and like got busy, and then had like a couple chips here and there, had a couple espresso beans, and like that. No, it's not sustenance now that I look back on it. Yesterday confused.
Well, I made you breakfast.
You did. You made me a great breakfast. You did. No, I don't want the good people to forget that like my breakfast was amazing today. There is not a gun pointed at my head. But yeah, we like walked over to the grocery store, and for some reason, like even people standing next to me was irritating. And I was like snapping to myself. It was kind of crazy, very unlike me, except for
like, oh, people are bothering me.
I know.
That's usually like my line. I'm the one who's usually bothered.
I know. Well, it was upsetting to me, and I didn't understand why until I found out that I was hangry. I put our Monday dinner in the crock pot, and I was like, you know what? I went to throw out the garbage.
Oh, you did?
I did. No
Thanks.
one came at me. So I'll tell that story. But then I heated up some white chicken chili. Delicious. I do a good job with that. And then within 4 minutes, I felt completely normal. When you came down the stairs, I didn't want to rip anyone's head off. And I am officially someone who gets hangry.
Yeah. You've been like this. I've been trying to tell you.
It felt like when it's like rainy outside and it stops and the clouds give way to sunshine. Like, no, it's crazy. I was like thinking like, screw it. We're going to put a reboot episode up this week. I'm not doing this today. No, here we are. Tried and true. Coming through. By the grace of white chicken chili in my belly, we're here. Your checkup, day and night.
Oh my God.
Bringing balanced health conversation to the people. Oh, well, how was your week this week?
My week? I don't know. It's fine.
Yeah.
Regular, degular week.
I do love when you say regular, degular. So we're going Christmas mode now. It's the earliest I've ever engaged in Christmas mode. And I think I was the limiting factor last year where like, I think sincerely you were like, let's do it around the same time. And I ended up saying no. I was also a busy resident at the time. But this year, even before Thanksgiving, we're like, those stockings are up.
The stockings are up. Put this janky Christmas tree up.
By the end of the night, the Christmas tree will be up. I'm nervous. Last year, it gave me a lot of agita. Chris, I'm going to send this one to him because he taught me that one back in the day, and I want him to hear this. Chris Nicholson, that is. Mm-hmm. I put the lights up vertically, and I can't tell if you were just being nice. I want to get
twinkle lights. But I don't feel like waiting for them, so we're just going to use our lights this year. And then hopefully we're not here for next Christmas, and we can have a new Christmas tree in our new house with twinkle lights.
Yeah, that'll be ideal. Oh, yeah. So I did. Well, so I put the lights up vertically last year because I think I saw a video somewhere that was the best way to go. And I don't know. I kept staring at it, and I was like, I can so obviously see that like, this is so imperfect and looks weird. So yeah. I don't know. I have to think about how I'm going to do it this year.
Probably just the old way. The tree's a little like, I don't know, sparse.
So this is a little reassuring to me. Maybe it's not my technique.
I don't think it's you. I think it's the tree.
Does it even really matter what way I put it up?
No, because I think it's going to look janky regardless. You know what I think will motivate us to like Not that we needed any more motivation to move out of the city and buy a house. When Christmas is over,
yeah,
we're putting the tree on the curb.
Oh.
So we will be Christmas tree-less.
Right.
So we will need to buy a new Christmas tree.
Need one.
But we haven't bought a new Christmas tree because they're like not inexpensive.
That's a good point.
And I feel like if we are buying a new one, we want to get kind of like a nicer one, or one that's like at least nicer looking, maybe one that already has lights on it, you know?
Yep.
But then we don't know like where our new house, what that layout's going to be.
Exactly.
What size tree we're going to need. So I don't want to buy one for this.
Yep.
Like I don't want to buy another little janky tree for our little janky house.
I gotta say, it's not, the ceilings are really tall though. So like you could go for it and get like a. But
where are you putting a go for it tree in our living room?
I know it wouldn't go over there. It would, the go for it tree would have to live in the like, I'm walking into the house area.
That's not a place for a Christmas tree.
Yeah, I feel
it's
like
not cozy.
I would love to listen back to these episodes from last year and see what we were talking about and be like, yeah. This time next year we're gonna do it.
Yeah.
Did we
December 26th? It's going to the curb.
I don't think we had a date for the wedding this time last year, did we?
No, we picked it in like April for a wedding in October.
Yeah, sick. We're good. We did some good work. Shout out Heather. Yeah, so that's something that's been happening here. On the menu this week is a teriyaki chicken in the crock pot. I bought a teriyaki sauce and whilst me being hangry, read the recipe again and figured out that I did not need a teriyaki sauce. And I was like, GD, I just wasted so much money doing this. It was probably like $5.
What did you need?
What did I need?
Yeah.
Well, all the stuff we had already, like soy sauce, a ginger, some garlic, the chicken, honey, and then slap that all in the crock pot for 5 hours. Put some rice, and then you make the light yum yum sauce. Which you don't like this meal for some reason.
I think it's the yum yum sauce I don't like.
I
don't find it very yum yum.
You don't need, no, and it doesn't need a yum yum sauce, but like, I don't know. It's like, it's chicken, it's lean, it's tasty, it's like, has an Asian flair to it. I don't understand. Well, actually, we talked about this.
I don't like chicken thighs.
So it's chicken boob this time.
Chicken boob.
Oh, God. Yeah, that's what it is this time. So maybe you'll feel differently about it, is my hope.
We'll see. I'll report back tomorrow.
And then last night we got into a holiday movie, Christmas movie, Holiday in Handcuffs, Melissa Joan Hart special. I got through about 45 minutes of the movie wondering what this woman's name was, knowing that I had seen her in multiple places. And nice movie, still half hour to go. Unsure if we'll ever finish it, but
we can finish it tonight.
Yeah, maybe we do finish it tonight. I like how you were like, oh, well, we'll watch a movie in bed and it'll be so cozy. And I turn on and you're out in 2 minutes.
Yeah, it was cozy. What about it?
Anyway. And then in our reality TV viewing experience, as you can tell, we haven't like gone out to dinner, which is fine. You know, we're just regular guys. The more
he downloaded a new money app, so now we can never go out to dinner.
I did. I was like, that was also part of me freaking out last night, just looking at stuff, and then I like the government website for my loans are back on, and I was like, oop,
dang,
this looks different. We'll see how the months go if the numbers don't go crazy. I know now I'm back to my old ways.
No one's getting a Christmas gift this year. We can't spend any money.
No, Scrooge is coming in now. That's not, of course, the case. I'd like to think I'm a generous guy, but who knows? And then, Secret Lives of Mormon Wives. They're back on.
Yeah, they're back on.
You're not as into it.
No, I mean, like, half the girls aren't on the show anymore. Or they're not like full-time cast people.
Yeah.
I am excited to watch The Bachelorette this year. Probably for the first time in like a decade, honestly.
Oh, right, because she's going to be... Mm-hmm. Oh, yeah.
And she's like so problematic, so it'll be good.
That's a good point. Oh my God, I forgot you said that. When's that come on?
I don't know.
Yeah, we'll have to find out.
Maybe like the spring. I don't know what the cycle of Bachelor Nation is anymore. Let's see. March 22nd, 2026.
Oh, we've got some time.
Yeah.
Yeah, well, we're set up with a couple of our other shows, a couple Bravo shows coming to an end, a couple starting. They're always good to us. You know, they pace them out. They have like one show after another. And then for the 2 TV setup, basketball is coming back on, football's in full swing. So, you know, our entertainment's pretty much covered. I feel like there's something else that happened this week that I meant to talk about.
Did you write it down?
No, I didn't have a big banter write down section because last week we just like went for it without having wrote it down. And
did you know they're discontinuing the penny?
Whoa, okay. No, I did not.
I feel like we should have a current event segment for you specifically because you never know what's going on.
I'm in there.
In the world.
Let's do it.
You're not.
No, I've been trying. No. I'm in there as in we should do this because I've been trying to we have our banter section. We have our meta section.
This is the section we need because I remember even a couple of weeks ago when it was raining a lot and you were like, wow, it's really raining. And I'm like, yeah, there's a Category 5 hurricane that just took out half of Jamaica. And you were like, really? No way. And then wait, something else happened. Oh, when they robbed the Louvre.
Oh, that was a
big
one.
You had no idea. And then we were at a Halloween party and 2 people dressed up as robbers and they had jewels and whatever. And he had no idea why and why people thought that was funny.
No, I had no clue. No, this is good. So let's and it's organically happening. So hit me with the highlights. What's happening with the penny?
I think they're going to stop production of it in 2026. Well, I think some of the mints already stopped because I think it's that it costs. See, I should have came prepared now with my facts. I was just trying to have conversation. I think it costs 13 cents to make a penny.
Oh, sounds like it's not worth
it anymore. Yeah.
Wow. Inflation.
Mm-hmm.
Well, and production. That's crazy.
Yeah. You didn't hear about this?
Not a single word.
Huh.
No. My life exists between 2 patient rooms.
Yeah, we know.
All right.
You're such a busy doctor. We know.
Oops. Wow, the penny's gone. What's next? Well, I mean, it also sounds like the nickel is on its way out. The dime, not too far behind.
A nickel, I forget. I was reading a thing about it. I think for every $1 made, at least for coins, I don't know if this is the same with paper bills, for every $1 made, it cost $1.75 or something like that.
Wow.
It costs more to make our money.
Huh.
Than what it's worth.
That's kind of crazy.
I know, especially since money is fake. So.
Yeah, you say that, but I downloaded that app now, and it's time to pay the piper. Let's see. Maybe I did write something down. Wow. Any other current events you got going on?
Not off the top of my head.
There's one related to an episode, this week's and next week's episode. So that's why.
Oh, the hormone replacement stuff.
Yeah. Which is important, but we're going to dole out our information slowly because we're in no rush. Let's see. Maybe if I had any banter.
What are we talking about today, Ed?
Oh, that's different. So today we are talking about menopause. As you probably heard in the news, there's a New York Times article that came out explaining that the black box warning for hormone replacement therapy was being removed by the FDA. So that's something we're going to talk about specifically next week. But this week we are going to introduce the concept of menopause for everyone listening. And this is not just for men. This is not just for women. This is for men who often get confused probably about menopause and maybe don't know enough about it. And so without further ado, why don't we take our journey about menopause, which should probably be called menostop. So menopause is something every woman who lives past midlife will experience. But it's a hot topic that is surrounded by confusion and a little bit of silence. So today we're talking about what menopause is, why it happens, and how it affects the body. And we're doing all of this before we dive into treatments like hormone replacement therapy.
We'll walk through the biology, common symptoms, and ways to stay healthy during this time.
And all of this is based on evidence from journals like JAMA, the BMJ, Cell, and the American Heart Association. So our first section is, what is menopause? Menopause is a natural stage of life when the ovaries stop making hormones like estrogen and periods stop for good. It's diagnosed, which is a weird thing to say because it's not a disease, but for lack of a better word, it's diagnosed after 12 months without a period that isn't caused by another condition.
Most women reach menopause somewhere between the ages of 45 and 56, with the average obviously being somewhere right around the middle at 51. It can happen earlier, especially if there are certain surgeries, medical treatments, or other health conditions.
And a quick but interesting fact is that about 1 million women in the United States enter menopause each year. So our next segment is about why menopause happens. Menopause happens because over time, the ovaries gradually stop working. They make fewer eggs and therefore produce less estrogen and progesterone. And these hormones help regulate the menstrual cycle. They also support bone, heart, and brain health.
And as these hormones drop, a woman's periods will become irregular and then eventually stop completely. And it's the drop in estrogen that affects many body systems, which is why it can feel, well, not feel like it affects your whole body. It does affect your whole body.
Right. So specifically, the things that happen is are, like you said, related to estrogen, and it does a lot. It keeps bones strong. It does support heart health. It is why women have a lower cardiovascular risk all the way through up until menopause. And then afterwards, they have similar rates of cardiovascular disease as men after menopause. So when we notice this estrogen dropping, that's when symptoms appear. And these symptoms are the things that bother women the most. And I'm talking about things like hot flashes or night sweats. Women also experience things like sleep problems. There also may be some mood swings that people experience or vaginal dryness. And so these symptoms themselves can be extremely bothersome. They can last for several years and affect daily life. Things that you're doing every day, they can affect your function. I've seen women who are practically driven mad by these symptoms, and it affects their function because they're moody, they can't sleep, maybe they're experiencing some metabolic changes, gaining weight centrally, and it's impacting their function ultimately. And while these changes are happening, they're also technically completely normal, maybe because it's what the body is naturally doing. So, Nikki, can you tell us a little bit more about how common menopause is and who's affected?
Well, it's very common, so much so that every woman who reaches midlife, why is it worded that way? Who reaches midlife will experience menopause.
Because some people don't reach midlife.
Globally, the average age is about 49, but that can vary by many different factors. 10% of women will experience menopause before the age of 45, and about 2% will experience it before the age of 40, which is called premature menopause. This can also happen suddenly if your ovaries were removed, or things like chemotherapy can make this happen probably earlier than it would have.
Yeah. I found those figures interesting and helpful because I think perimenopause, which will get its own episode, don't you worry, but perimenopause is something that is very much in the zeitgeist and talked about. I've had patients come in and say like, oh, all the girlies are talking about perimenopause now, and reasonably so. And I think this is very helpful to say this out, like, oh, well, 1 in 10 women gets before age 45. And like, it's a concrete thing to go for and say like, yeah, it's earlier than some, but maybe not completely abnormal. So common symptoms, we've alluded to some, but symptoms can vary widely from person to person, but here ends up being what's most common with a little bit of extra information. So hot flashes and night sweats are very common, so common, in fact, that they affect up to 75% of women, and I'm sorry, can also last over 7 years.
Mm.
You know,
like that TikTok sound. I forget what it's from, but it's that girl and she's like, "Oh, I love being a woman."
Well, you know, this actually helps because the recent lifting of the black box warning, a little ditty into next week is that, you know, now it's reasonable to consider doing hormone replacement therapy, which is like the most effective treatment.
Yeah, I'm definitely going to get myself some of that.
Is
what's that average age? 49 for my 49th birthday.
Well,
that's what I want.
For 50, it's like women within 10 years of menopause that it's reasonable to do this. So if the hot flashes like routinely average, maybe, or they can, rather not routinely, but they can last 7 years, you know, you're well covered using the treatments until like age 60 or whatever. So that's something. Before I move on, did you have any other thoughts about your 49th birthday?
No, luckily it's very, very, very far away.
Very far away. Women can also experience vaginal and urinary symptoms. This would include things like dryness, discomfort, and irritation. So these often worsen with time. This is a little nugget. It's interesting because I tend to see that women of a certain age get something that feels like a urinary tract infection, and then it kind of goes on, goes off, bothers them. You do all of the routine testing, get the urine, maybe you get a urine culture, and you see that there's nothing, and there's no bug growing in there that's giving them this. But it actually could be these vaginal symptoms of menopause. So this is something that has a solution. We're going to talk about those later in the episode and next week. But these are not things that women have to live with, especially now. And even before, there were options that were totally reasonable. So it's definitely things to do and be proactive, not just kind of suffer in silence like what we talked about earlier in the episode. Women can also experience sleep problems, and this can look like a variety of things: difficulty falling or staying asleep. Mood changes are also common, looking more like things like anxiety or symptoms of worry about anything in life, irritability, and depression or sadness, or just a very broad-based definition that we have a whole episode about. There are other changes that happen in menopause, which include lower libido or sex drive, memory issues, weight gain, especially around the belly. People's bone health, we talked about this last week, peaks at 30, but there's even more of a decline with menopause, so bone loss, and shifts in cholesterol and blood pressure. All things that go hand in hand with menopause. But something that's really important to know is that not everyone has all of these symptoms. So this is not a sentence for all women who reach midlife that you're going to get these things, thankfully. And just because they're common doesn't mean that you'll just have to, tough them out as if it's something that's you're destined to have. Something, just a little ditty to include in here, is something I mentioned earlier, but wanted to call out specifically. Going through menopause does tend to increase your risk of osteoporosis. That's why the guidance for screening for osteoporosis and osteopenia mainly starts in women at age 65, and that's usually where the guidance starts and ends. There are other situations, of course, but because that decreased estrogen is present, because there is decreased estrogen, that leads to not as vivacious bone health. What we also know is that when women enter menopause, the cardiovascular risk kind of evens out between them, women and men. Biologically, of course. So, Nikki, I've been rambling. Just wanted to put those couple things in there. Can you give us some ideas or things to be proactive about? I think a lot of women probably already do these things, but maybe there's some that people don't know about. So what are some lifestyle tips for women to help with symptoms of menopause?
Let's see. For the good, lovely hot flashes, you can dress in layers so that, when you're out in public and get a hot flash, you can take a couple layers off. Using a fan, you can get one of those little handheld fans on Amazon. Keeping your bedroom cool for, again, hot flashes or night sweats. Also, if you're not already keeping your bedroom cool when you're sleeping, what are you doing? Staying active, doing things like walking, yoga, swimming. These will just all around help with your mood, your sleep, and your weight. Eating balanced meals with fruits, veggies, lean proteins, and whole grains. Maybe something like the Mediterranean diet, which we love to talk about.
Oh, we do love a Mediterranean diet.
Avoid smoking and limiting alcohol and caffeine. Practicing relaxation, so deep breathing, meditation, or mindfulness. And then you can use a water-based vaginal moisturizer or lubricants if that's giving you some trouble.
Yeah, all great options, things you can quite literally start tonight or whenever you're listening to this. And if you do all of these things and you find that symptoms still interfere with the quality of your life, there are now, plenty, there always were, but there are plenty of medical options that exist. And what ends up happening is the most effective of them is some way, shape, or form of hormone therapy. And that is exactly what we're going to explore next week because it's a hot topic in the news. There is a lot of conversation, which I think is perfect for a podcast, to kind of explain why this was such a poo-poo or like in the medical world, like something that was just like reserved on the side and kind of like, oof, it's very high risk.
It's because everyone hates women.
I can't wait to talk about it, but for next week. And then, but there are also other ones too. There are also non-hormonal treatments to ask your doctor about that we won't go in and dive in each and every option, but it's a reasonable question. You could sit in front of them and say, hi, I'm having vasomotor symptoms of menopause, or I'm having hot flashes. Are there non-hormonal options that can help with this? And they will either say, yes, I am familiar, or they will refer you to someone who knows more than them. All reasonable things to ask your doctor. And now increasingly so, like also reasonable to probably ask about hormone replacement therapy. So, menopause, it is a normal stage of life, but I imagine, because I have not experienced menopause, I will not experience menopause, that it feels overwhelming and maybe not talked about so much. So that's why, altogether on this show, we feel that knowledge is power. And that's why we covered what we think is a really important topic today. Like we said, next week, we are going to talk about hormone replacement therapy and updates in the recent news, and why we are where we are today. But until then, thank you for coming back to another episode of Your Checkup. Hopefully you were able to learn something for yourself, a loved one, or
a neighbor going through menopause.
Send us a email at yourcheckuppod@gmail.com. You can find us on Instagram. You can follow my own personal Instagram and see my reels. You can share this with a loved one or a neighbor or a friend. We are always looking for more people to tune in. And most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.